from me and Carl this week. Yes, hello. Today I wanted to talk to you about the topic of self-harm. I haven't really discussed self-harm behavior, and I think it's an important topic, especially when we are in the mental health world, to focus on. And just to define what it is, what is the purpose that people use self-harming for, and what are some options if you are self-harming and need some support. So self-harm or self-injury is non-suicidal injury to your body, your skin, or in some way hurting yourself to deal with emotional injuries or maybe anxiety, depression. Self-harm can come in various forms. So the most common ones are things like cutting, burning of the skin. I have seen people also use eating disorders as a form of self-harm, like lashing themselves. There's various different things that can be considered self-harm, but basically it has to be in some way like damage or pain caused to your own body. Now, the difference between self-harm behavior and suicidal behavior is that the intention of self-harm is not to complete suicide. It is not to end one's life. The intention usually with self-harm is that there will be some kind of temporary relief for emotional pain, guilt, shame, or any of those other like really intense emotions that people have not learned what I call distress tolerance for, so they feel unable to cope with them. They use cutting or burning or these other forms of self-harm like starvation as a way to take away from the emotional pain and feel a physical pain. A lot of people like cutting because of the idea of actually seeing blood and this feeling that maybe they're purging their bodies of various things. Self-harm behavior is often an attempt to have some control. So I've heard the idea that if I'm going to experience all this pain in my life, then I want control of how that pain feels, and I want the final say on what happens to my body. So self-harm in itself is not a diagnosis in the DSM, but it isn't a mental illness in its own right. But self-harm behavior does definitely signify that someone has a lack of coping skills. They maybe don't have a way to deal with a lot of the pain and distress that they feel in their lives. And so this for them is an outlet, similar to something like an addiction or an unhealthy coping behavior. Sometimes people who are suffering with severe depression self-harm because they do not feel emotion or they feel like they feel nothing, and the self-harming behavior is a way for them to express or experience a feeling. So that is another as well mechanism that self-harm is used for. Now, if you are struggling with this type of behavior, I obviously suggest that you need to talk to someone. I believe that a really good trauma-informed therapist, a family physician, a psychiatrist, any of these people could direct you in the right pathway to dealing with the underlying issues that are causing you to want to self-harm or to actually self-harm. This is something that I really don't suggest suffering with by yourself. Although it may seem like it's embarrassing or shameful and you don't want to share this with someone, sometimes self-harm behavior can lead to self-mutilation, and it can lead to some other really severe consequences, severe unchangeable damage to your body. So lots of people go through this, and it's something that you shouldn't be ashamed of, that you need to seek help for and get the right treatment to help you overcome and find coping skills in your life to deal with the underlying issues. Because like I say, the self-harm is not the presenting issue. The self-harm is the symptom, usually, of trauma in our lives, of distress, of a mental health problem, or of just a struggle that we're going through and feeling really out of control and like we need an outlet. Thanks so much for watching this video today, you guys. If you have any questions on self-harm or you want more information about it, this was just a brief description of what it is and how you can work with it. Please let me know and don't hesitate to comment below. I have my free ebooks, and also my paid 21-day course is down below, as well as my Facebook page and my other social media. I'll see you guys next week.